All right, so today we're going to talk about OCL, that would be the Orthoglass is what I'm discussing, using Orthoglass splinting. We have this 4-inch roll in the clean supply room, and we're going to transition from the pre-cut to these because the pre-cut, they don't come in every size you need, and those are more for the clinic. So the rolls come obviously in a box. When you get done measuring how much you need, you then cut it at the desired level. The only thing you have to make sure when you're done is that you have the material inside, so sometimes you have to fold it over like so that you have a fairly decent lead, because when you're done with it, you want this to be able to completely fold through and then like that. So it needs nothing from like right here to right there to be able to do that. Once you have that, it's airtight. If you don't, you're going to open this, go to use this, and find half your roll is hard and unable to use. So there you go. So that is it. Now, scissors. To cut this, these will not work. If the doctor asks you for your Raptors, do not give them to him, because take it from me, who's actually had to send a pair back to be resharpened, it will ruin your scissors in really quick order. We have special scissors, ta-da, that we have gotten just for Orthoglass cutting. They are found in the clean utility room, chained to above the Orthoglass rolls. Why are they chained? Well, because things tend to run away, and it's important, and these are expensive. Also, now everybody knows things disappear around here, and they do it at every other hospital, and they are chained in every hospital that you will go to work at. Now, for this purposes, we're going to use a smaller pre-cut Orthoglass. We'll get to that in just a minute. With Orthoglass, you do not need any of this. This right here is casting tape that you use for an actual cast. So you're not going to use that unless you are an orthopedist. Padding. You don't need padding with this. In fact, they don't recommend it, and you can, it just, don't even think, well, I'm going to use it because it's more comfortable. No, it's not. When the time this thing gets all bunched up and ripped up and wet, it's not comfortable. In fact, it becomes a infection control problem and a circulatory problem, as you want no wrinkles underneath the Orthoglass. What you will need, however, is some ace wraps. Usually you're going to use 4-inch, 3-inch, and maybe a small one if it's going to be a hand, or if you're doing a thumb spica, you would use a small one. So there you go. Now, you're going to use a towel. You'll need 2 towels. I have seen some people use paper towels. No, don't do that. Once you wet this, you have to go pretty quick because it dries. Do not try to re-wet this. It doesn't work. So you lay down your towels. You want double towels. And I'll show you why in a minute. So double towels, kind of like that. Then we're going to open up. You will need somebody to help you, because it's hard to put the splint on, hold the splint correctly, and wrap with an ace wrap with just one person. And you do have a limited time before it starts drying. You can tell the person that it may get kind of, well, it'll warm up. You can put these on with water or without. Using water speeds up the drying process. You're going to sit there half the night holding it still if you don't use water, but it'll still harden. Now, when you take out or cut off your roll, first thing you do, smooth out your roll. Now, we're assuming you have, this is the size you're going to need, both width and length, and that all depends on the splint you're using. Now, this is designed, because it's pre-cut, it already has this stuff pulled out. When you cut it, I'll show you, scissors, cut. Now, you've got that Orthoglass, that right here is fiberglass. And when it dries, it's going to have sharp little fiberglass pokey things. Nobody likes that. So what you need to do is just pull out this felting material. So stretch it out so that it is going to cover the ends of the fiberglass. And as you see, it covers the end of the fiberglass. So that's all you have to do. This batting is made to be next to the skin so that you don't need to improperly use other stuff, like in rolls of padding. That's for casts or other splint material that doesn't have that. So now you're going to take this and you're going to take it over to the water. Usually I'll have the towels right here, and hot water does speed up the process, but it also makes it a lot hotter against the skin. I suggest cold water, which is what the company suggests as well. So you wet it on both sides, kind of like that. So once you get it really wet, this should also tell you why you really don't want to use any of that batting material, because it's going to get soaked and then it's going to dry slowly, and they're going to have all kinds of, like macerated skin. So take this over to your, now obviously if you're doing a long leg splint or something else, you'd have the towels for the appropriate size splint. You take this and you do that with it, roll it up really tight, and then I always kind of push down on it and then unroll it, and there's your splint nice and dry. Now the company recommends that you take your hand and do that with it so that you smooth out so there's no lumps or bumps or wrinkles that are gonna. So there you go. It's very pliable, but now the time is ticking, you gotta hurry up. So you're gonna wanna have your splint or your ace wrap and the splint. And this is not really a sugar tongue because it's way too small, but we're gonna use it kind of like one. So we're gonna go like that. Kind of bend your arm up, there you go. And this is a midget. Now, in order to properly splint anything, you have to splint above and below, the joints above and below the fracture. So this would be a fracture right in here. You could use it for an elbow fracture because it's holding it still. Now the doctor should be the one that gets, you can, if you've been trained in splinting, you'll know the splint, but the doctor can tell you the splint that he would like you to use. And then we're just going to we'll do your wrist here. How am I going to do this? We'll do it this way. Put your arm that way. So we're going to modify this even more, and we're going to do a gutter splint. See how easy that is. Now in this case, if you were going to do this, you'd probably use that 2-inch. We're not going to use the 2-inch. So as you're holding it on there, you're going to wrap this around it. Now with this splint material, besides the fact that you don't have to worry about padding because this is already padded, if it swells up, the patient can loosen up the wrap, and you do need to tell them that if it gets numb and tingly and their fingers get blue, loosen up the ace wrap, because once this dries, the fiberglass, they can take it off and the fiberglass will be in the permanent position. You usually need about 2 rolls of this, sometimes 3, depending on if you're doing a really long leg splint, you may need even 4. So you do that. If I was doing this for a patient to send home, I would use another roll. But also when you're doing hands, you want to stop at, we're a little high on the hand, you want to stop at the palmar crease. You don't really want to go up too high because that then gives you issues. So this is basically to show you how to put a splint on, not the appropriate way to put on a gutter splint. And remember, palmar crease is as high as you go on a hand splint on both sides. Because too high, they're going to hit right there, and then they're going to break down in problems, and you don't want to end up with finger issues either. And then you just kind of let it dry. If it's over an elbow, you kind of need to hold the limb in a neutral position until this dries. It dries pretty fast once you make it wet. If you put it to the side, you cannot cut it once it starts to dry. Don't even try, because you're going to end up with, besides nice sharp pointy things, you're just going to ruin your scissors, even though scissors. Now you can just have the patient rest, because it should be at this particular point enough that unless you happen to have a 3-year-old who's really into moving, you can go do something else and just let that sit. It takes, you can feel it getting warm.
Yeah.
And I can feel it hardening because it's kind of hard to move it now. So you really do have to have everything set up before you get it wet, or you will not get it on before it hardens. Once it starts hardening, forget it, because it's going to end up with pressure points and not be an actual hard or an actual splint. It'll be something that you're going to get laughed at by the orthopedist that sees them. And that's pretty much it. Oh, the other thing to remember, especially when you're putting on posterior leg splints, is people try to walk on these, they will break down. They don't do well wet or with walking. They're temporary until they get to the orthopedist, but they're 2 weeks, 3 week temporary. Oops.